Well, welcome everybody to Community Connected Health. I'll say co-host Skip Lowe. Do I get to say with North Risk Partners? Do we decide against that?
Sure.
Okay. And joining me today, the main host,
Colton Storla.
Great to be back. Great to see you, bud. Boy, what a year, 2026.
Yeah.
Before I jump into that, I've got a little story for you. I just got back from this thing called a vacation.
Oh, yeah.
Yeah.
That's nice.
They actually allow us to have vacations at our company, which is great. Great employee benefit. So I took my family down to Mexico. Never been to Mexico. And
That was your first time?
First time.
You're pretty well traveled, but...
I've driven around the world probably 20 times in my car, but it's been from border to border of Iowa. But yeah, didn't make it to Mexico ever. So it was...
Cabo San Lucas. I love that place, actually.
Yeah, the Monte Carlo of Mexico. And it was great. I've had a number of people say, what was the best part about it? And I said, well, I'm going to give you 3 answers to that. Obviously, spending time with my family, which was great. And then the second thing was the sunshine, get some vitamin D. And then the third thing, I don't know if I'd say it was the best part, but it was definitely the most intriguing, and that is that I noticed that we went into Cabo on our second day, went to go work out. Love to do that. I got to be the brand, right?
Attaboy.
Selling health insurance, I got to be healthy.
No breaks on vacation.
No brakes on vacation. I don't think our car had brakes on it either, by the way. I think we slammed into a wall. So anyway, moving forward, the one thing that I noticed about it was there were pharmacies everywhere.
Really?
Yeah, on every corner, in between, pharmacy, and they listed all the medications you could go ahead and just walk in the door and grab. You didn't need an insurance card. All you needed to have a little thing called cash.
Yep.
And they had anabolic steroids and Retin-A, which, by the way, is about $500.
Steroids even.
Yeah. I was like, can I get pumped up after 2 days on those things? Anyway, I decided against it, my better judgment. But
I have heard of people going to Mexico to get medications.
Yeah. I mean, we've heard about this.
Yep.
And I hadn't seen it in person. I didn't realize that this was such a...
You should have taken a picture
market.
of all the prices and compared them against the prices we see.
They don't have a price list that you got to negotiate.
Oh.
So anyway, without getting into further fun details here, it just struck me that, if you just walk in with money, you can pick up pretty much any medication. It could be pain medication, so controlled substances.
They didn't ask you for your insurance card?
No. And so here I come back from a great vacation, what I would consider to be well rested in my book. And first thing I'm doing is I am fighting for every pill for my clients. That we have prior authorizations. You might have switched some PBMs this year, and all of a sudden the prior authorization forms didn't make it through the system or what have you, or you changed your formulary. And I was struck by it. And you can make the argument or debate the merits of, well, they have a different kind of distribution center down there. Do we really know these are drugs that are coming out of manufacturers, et cetera, et cetera? But it just dawned on me. It's like, man, we have so many things that are just holding people up from getting their medications and getting the services that they need. And I mean, I'm sure there's drug addicts and there's drug issues down there like there is in the United States. And my son said finally, Dad, just remember what you said. And that is that in the United States, we don't take drugs, we pay for them. So I was just astonished by that. And so, all right, so we'll jump into...
Well, I think that's a good point because to your point, with employers, they're making changes, they're getting renewals, or they just went through we went through a big renewal cycle. And as costs are going up, which we've seen record increases this year, what do employers do? They tend to either raise deductibles or they jump from one carrier to the other carrier to see who can give you the least bad renewal. But they don't take those things into account. Like, what does raising a copay do to their people? What does moving from a traditional copay plan to a high deductible health plan do to their people? What is moving from one carrier to the other carrier? And yes, there might be a different pharmacy benefit manager, different formulary, different prior authorizations, different step therapy, all these things that create all of these, roadblocks to get their employees, access to medications. And so with the topic that we're going to, jump into here, hopefully when you move to these more, self-funded, customized health plan approaches, you can get more consistency with your plans, your formularies, because you get to make those decisions yourself instead of being dictated by an insurance carrier.
Yeah. I think you hit on one of the biggest frustrations that I have on fully insured plans and just carved in arrangements is you really don't have access to that formulary. And it's one of those things that you're hoping and praying you don't get a phone call after January 1st to say, hey, my drug went from being $15 to $45. What happened? And you're just sitting there going, I don't know, I'll look into it. So there's just a tremendous amount of frustration for the patient and for the people that are trying to take care of, that patient, whether it's a prior authorization or in that instance where, I don't know about you, but $25 is a lot of money to me. And that's thankfully a tank of gas these days, right? But this formulary thing just drives me crazy because it's one of those things you don't realize, and it doesn't necessarily tie itself to the changing the PBM, right? Because formularies change every 6 months or every year. And so you just got a whole bunch of bad surprises waiting for you. And so, yeah, you're right on. Getting more control, getting the visuals into what the plan is set up to be. Can we set up a closed formulary, or do we have access to go ahead and control our formulary? And that goes part and parcel with what we're talking about. But before we do that, year in review. How was your year?
It was a good year.
Yeah.
A lot of challenges, but challenge brings opportunity. Like I said, I think you and I saw record increases with some of the prospective groups that we got pulled into.
Yeah.
Either stop loss was going up or they're in a fully insured plan, and, the BUCA carriers like Blue Cross, United, Cigna, Aetna, I've seen double digit from, low teens to high 20s. I even saw a 30 and 40% increase on a couple groups that I was working on. So, I'm coming up on 9 years in the business, and I would say this has been one of the difficult ones to try and find solutions for employers to try and, level off their costs as much as possible. But it was also good because I think employers are starting to wake up and saying, hey, what we're doing just isn't working anymore. We can't continue to raise our deductibles. We can't continue to take on these double-digit increases. What are the solutions that are out there? Because we're not getting, the expertise that we're needing. Especially when we are trying to work with new groups, the biggest roadblock that we run into is we already have a broker, or we already have an advisor. And that relationship's been pretty strong, which is a good thing. We love loyalty. But if it's at the detriment of your business and your people and your health plan and your employee benefits, I think more employers are starting to look now externally like, I'll work with anybody that's willing to help me solve X, Y, and Z.
Yeah. Well, when you start seeing $3,000 a month for health insurance premiums, there's a lot of frustration there because that's likely more than they're paying for their mortgage or their car.
Yep.
Together. And so they're looking for answers. And now this is just a reminder of what community connected health is about. We're not here trying to keep the secret sauce under the lid here. We're out here trying to tell you what our experiences have been and what's happening out there in the marketplace. And if it's a benefit to the consumer, number one, great. We want to try to educate as much as we can to let you know what we're seeing out there as agents, give you our version of the story, so to speak. But also, we're trying to help the medical community. And then ultimately, we're trying to help our industry with the fact that we're trying to keep these precious dollars in our communities. And so, yeah, this has been the toughest year I've ever seen. But I know you heard that a few times from me. And I've had some doozies, but I've never seen the renewals like this. And so for me, the one thing that really stood out in the renewal cycle, especially for these increases, was just the amount of claims we're seeing. So there was a claim intensity aggregately as opposed to a couple of years ago we're seeing, oh my gosh, there's $1 million claims, shock losses. And so those are certainly a part of that. But the loss ratios, right? Which the loss ratio is okay, for every dollar you spend for healthcare, how much, was paid out for your premiums, how much was paid out for the claims. And a lot of our groups were north of 100%, and it still continues. And I'm seeing renewals now coming out for this next year. I'm going, it's frustrating
Well, it's just constant tweaking that we have to do.
Yeah.
Even with the groups that are, fully insured and not, utilizing some of these cost containment mechanisms that we've talked about thus far in our previous episodes, like direct primary care, pharmacy, things like that. Well, what would their renewals have been if they weren't taking advantage of some of these solutions?
Yeah.
Even though they're seeing, some increases, I mean, they probably would have seen even larger increases.
Yeah.
And then, I think we spent a lot of time educating new employers to us that, hey, these are all the other opportunities that are out there.
Yeah.
This is the difference between fully insured, level funding, self-funding, which we're going to dive deeper into in those three categories. But yeah, just a lot of education that was happening.
Yeah.
Which is needed. I mean, we're in an industry that is super confusing. Even we work with a lot of medical groups and they're confused by health insurance. And out of all the people that you think should understand how insurance works, oftentimes, unfortunately, they don't. So we're educating not only the medical professionals.
Yeah, it's multidimensional, and and I think the nice thing is, if I can say it that way, is that we're getting asked these questions, and I feel like we've done a lot of work over the last 5 years together, and grueling. And we've learned new things and old things, and we're trying to figure out how the future looks. But at the end of the day, the challenges are paying off because all the information that we have armed ourselves with, we know who's been naughty or nice in the insurance business. We're kind of the Santa Clauses now, and we know the providers and the mindset that we're looking for. They're definitely aligned with us. I think we'll go right into our topic. But when we're going to a prospect or have a client that is fully insured and going to self-funded or some derivation thereof, I like to say anyway that we're going to have a different kind of conversation with your employees. Who's your insurance company? And they're going to look at us and they're going to maybe pull out their ID card and they'll name off a brand name and I'll say, well, actually, starting January 1 or whatever your renewal date is, you are the insurance company, and you are, and you are, and you are, and I am too. Mm-hmm. I'm part of this ecosystem that we're building for you. So from now on, we're going to eliminate the blame game of you thinking a big pile of shiny money is going to a shiny building in a faraway place. So we're going to hold everybody accountable here, and we're going to give you these levers that you can pull for yourself and make your decisions to give you the best care at the lowest cost. And yes, it is working, ladies and gentlemen. People are getting the hint, and I think the dollars that they're having to pay, they're starting to ask more questions. I think insurance was just something that was just like a riparian right. Like I get to drink water or I get to breathe air, right? It's just part of my life, and it's become more than a nuisance.
Yeah, and I think that's kind of a good area that we can circle back on as we wrap this podcast episode up, because it is really important that employers, as they start to embrace these new strategies, that company culture has been, one of those hot topics: recruitment, retention, company culture, trying to, enforce that in your employee population so that you can retain these employees, and trying to get them educated and ingrained that, hey, we are the insurance company and we all need to, this is a group effort, because no one likes being told every single year that either A, your deductibles are going up or your costs are going up. And that's what a lot of these employers have conditioned their employees every single year. Well, how bad is it this year?
Yeah.
Am I going to pay more and get less? And that's what's happening. So I think even before that, getting into kind of back to the basics with fully insured plans, and really what that means to an employer. These carrier-based fully insured plans, it's not a surprise that, Blue Cross Blue Shield or United Healthcare, Cigna, Aetna, they dominate various marketplaces across the United States. They give you these, off-the-shelf product plans that, you don't really get to, customize or tweak besides your deductibles or your networks, PPOs, HMOs. But they've built these, vertically integrated models where not only are they, profiting off your premiums, but since they own the network, they own the pharmacy benefit managers, they own every piece of the pie, they're able to capitalize on every area of your health plan. So even though that you're medical loss ratio may be very poor and they're raising your rates, they're still making money at the end of the day. I mean, in previous episodes, we talked about, them being casinos. The house always wins. So a lot of it's just educating the employers on, okay, well, how do I put you in the driver's seat so you are winning at the end of the year and not some insurance company? So in basic terms, a fully insured plan is, you get a rate based off of however employees you have. You pay that rate over 12 months. You get no access to data or very limited access to data to know how your plan's performing. And then, your renewal rolls around and it's probably going to be an increase. And you ask why? Well, maybe your broker tells you your loss ratio is bad. Well, why was my loss ratio bad? Well, I don't know. Medical inflation, pharmacy's high, this and that. Really not a clear picture like any other area of that company's business that may be seeing an increase in, cleaning supplies or steel or whatever. And, well, they know exactly what they're paying and the value that they're getting. Where they could just go shop around for those other items. And they've optimized, their P&Ls. But this thing called healthcare just has been one of those things on there that they haven't seemed to figure out. And
well, it's an emotional transaction, right? You get sick, you want to get fixed, and you're ready to pour Fort Knox on it. And the other thing of it is that even on the limited data side, you mentioned that. You're supposed to have folks in your organization that have access to HIPAA information, and you sign your business associate agreements and those things. But now what I'm seeing is when I do get the large claims data, it says sensitive diagnosis. You can fill in your own blanks there, but it's like.
So how do you even properly, know what your employees need? Is it are you dealing with high cost prescriptions? Are you dealing with mental health? Are you dealing with, weight loss and diabetes and some of those things? So it's like you don't get any data to be able to take action. You're just kind of shooting from the hip and trying to make decisions for your business, and it doesn't work.
It's frustrating on so many levels. But I'm reminded of a movie, Gumball Rally, in 1975, one of the all-time classics. And so these guys all raced across the country, and I remember one of the characters, Raul Julia, was the actor, great guy. And he had a Ferrari, and before he took off in New York City, they were going to Los Angeles, and he took the rearview mirror and he ripped it off the car, the windshield. And his driving mate said, "Why'd you do that?" He says, "What is behind me is of no consequence." And that's a fully insured health plan because you're looking at everything in the rearview mirror. And so we got to pull off that rearview mirror. And we got to look to the future. And that's what we are able to do is we can see real-time information and we can do predictive modeling and all the things that people have been talking about what they can do. We're seeing it. And so the biggest part is the employee member buy-in, because then they're the ones that help us see ahead as opposed to looking backwards, because telling everybody how bad a year they had without really getting into details is just not going to work anymore. What is behind me is of no consequence. Welcome to self-funding. All right. Well, let's talk about it. So what happens when you go from a fully insured? Have you heard your prospects or your employers say, "Oh, we tried that a few years ago. That didn't work out well for us"? And
well, I think, even when I first got into the business, a lot of the groups I was working on were fully insured with one of the big carriers, but level funding started becoming more and more popular. United Healthcare came out with their level funded plan. I think Cigna had a level funded plan. Aetna had a level funded plan. Some of the Blue Cross associations had level funded plans. So I think there was a lot of other independent TPAs that were putting together level funded plans. So probably these carriers put these level funded plans to protect their business. And it's like, okay, if we're going to lose this group to another level funded plan, let's just try and keep them. If we can't keep them fully insured, let's just put them on our own level funded plan. So I see a lot of that. And I actually worked on a handful of groups for January 1st that were on a level funded carrier based plan. And with those plans, a lot of times they don't even provide you with any surplus opportunity. So if you end up paying more in premiums, is there any premium dollars coming back or what's available in your claims fund? Oftentimes that's not available, or they're only giving you 50%, which kind of makes me laugh because it's like, that's your money. Why is the carrier keeping half of your money just because you had a good year? Like, it's not anything that they did.
Half a hog's better than no hog, Colton.
Yeah, that's true.
Right?
It's better than the fully insured, obviously.
It is. But yeah, so you've got this nice clean little bucket, fully insured. I just make it go away, and I just want to make sure I can get whatever I want when I want it. That's the fully insured model. And then this level funded, it's self-funding with training wheels on, right?
Yep.
So you got some access to additional data. I've seen a lot of volatility in that market. I don't know if you want to share or expand on that, putting you on the spot, but it seems like we call it the 1 year Charlie, right? Where it's like, oh, this is great. We saved 20%, but next year we got whacked over the head with a 35% increase.
Well, it just takes one high cost claimant to just turn your plan upside down. And if you don't have a strategy around high cost claims and pharmacy and DPC and all these other things, then yeah, it's just a ticking time bomb. And so some of these level funded carriers are just trying to cherry pick the healthy groups. And then if the claims go south, then okay, we're just going to take them back to fully insured, and no loss, no gain for them. Yeah. But it's a big loss for the employer. And so, yeah, I was at a conference earlier in 2025, and one of the main people that put on the conference, she came up to the mic during our panel, and she goes, and to all of you, and there's a bunch of clinic administrators in the room, and she said, and self-funding doesn't necessarily mean self-funding with a carrier.
Yeah.
There's better ways to do it, especially with all these groups. They work in healthcare. You're still feeding, that the buca carriers. Yeah. And they need to be more independent minded, finding that independent TPA, independent stop loss, pharmacy benefit manager, network or non-network, and really trying to customize, because I even had a gentleman at the end of the panel come up to me and said, hey, our broker, we told them that we wanted to look at self-funded options. Our broker showed us, a Cigna level funded plan and this other level funded plan. And it was higher than our fully insured plans.
Yeah.
And I'm like, well, that's one way to do it. It's not the right way to do it.
Yeah.
And there's other opportunities out there for you.
Yeah. Well, let's not forget that, the large carrier model has a role in, self-funded cases and clients. And if you get into a large enough company, then, they do a pretty good job at their third-party administration. But at that point, you can carve out the stop loss. You can carve out the PBM. So again, that's where you're going to maintain the control of it. And so you're gaining access to the administration. They can do a great job at that. And you gain access to their network, which is good, but you're going to be limited on doing custom plans at that point, right? Yep. So it might be a good stepping stone to get where you want to get ultimately, but there is a role for it, but there are some limitations.
Well,
right?
It might be a good first step into, like you said, self-funding on training wheels, moving to a fully insured, to a level funded plan. Well, now you're going to start to get some claims data.
Yep.
So even if you did move to one of the bigger carriers level funded plans, that we could argue that is a good stepping stone. And in simple terms, why it's self-funding on training wheels, because you're still going to pay a fixed or level premium throughout the year. It might be a 12-18 contract where, a portion of your premium goes towards, purchasing stop loss to protect you and your people of high cost claims, administrative costs, and then your claims fund. And so that's how your premium's being broken out. But now you pay that level premium throughout the year. And is there money left over? If there is, okay, that could be coming back to you after the run out period. Yeah. And even if things did go south, again, no loss, no gain. Even if your claims blew up, you don't pay anymore. But if your plan ran well, then you could see money coming back to you. But even after a year of that, then it's like, okay, now let's really ramp this up and let's, try and customize this as much as possible. And let's work with vendors that have your best interest in mind, from the TPA to the network or non-network, PBM and everything else.
I totally agree. And I think also part of that transition into a self-funded mentality is depending on the size of the group, but just having them understand the terms. I mean, we have a duty to make sure that our clients are educated, know what you're selling so they know what they're buying. Because there are some things in here that you're going to do a little bit differently when you're in a self-funded case. Reporting's one of those, right? For the Affordable Care Act, the CAA, and you've got your gag attestations and things of that nature, which I won't bore the audience on. But, depending on the sophistication of the buyer, and make sure they understand the terms of the agreement, because I've seen a lot of brokers out there, because people out there and the carriers aren't going to educate you. They want to get the business, and they'll structure a self-funded contract from a fully insured on what they call a 12-12. So that's incurred in 12 months and paid in 12 months. And then you got this renewal, and all of a sudden you're getting automatically a 25% increase. And people are like, well, how is that so? Well, you've got run out, you got claims that were incurred in the last quarter that are going to run into the next year. And you've got to put that in your financials. You got to say, hey, I always just put 20%. Say, I'm going to add 20% to the aggregate factors. All in, you're going to have it, that way they can set their budgets on there. And so if you've got a big enough sophisticated client, the first time into self-funding, and say, let's do a 12-15 contract. You've got 3 months of run out to protect you on your stop loss. That's going to be your individual deductible for everybody, and maybe do the same thing on your aggregate. That way you've taken a responsible step. And then the next year, you maybe overbought that contract. Let's go with what they call a 24-12, which means we're going to go back 12 months into the previous year, get any of the claims that are sitting out there to be accumulated and credited into your new stop loss contract. Because if you just keep buying 12-18s, you're buying trend for the future. I mean, if you at the beginning of a year you say I want a 12-18, now you're asking an underwriter to go out 18 months from that date, and there's about 1% increase every month in inflation. So, again, depending on what kind of buyer you are, I like a 12-18 the first time in. Hey, this is a great way to just kick the tires on this to see if it worked, and then hopefully you've got money in your reserves at the end of the year. You can say now, maybe in the third year, we go to a 24-12 and get this thing buttoned up. So there's a process here, but it comes down to we really have to educate our clients on what they're buying.
I think education and risk tolerance, because like you said, if that was all just gibberish to somebody, then at the end of the day, I mean, what our clients or potential clients want to know is like, what is the risk to me and my people? Yeah. And there's a right way to do it, and there's a wrong way to do it. And there's a very, conservative way to do it that they're not left holding the bag at the end of the year. So if you're working with, an intelligent advisor that knows how to build these plans, you've got all the protections in place, because I think there's also plenty of brokers out there that are selling against level funding or self-funding, saying it's too risky, it's this or that, because they want to keep you in that fully insured plan because it's safe and it's predictable. And maybe they don't understand level funding or self-funding, so it's easier for them to administer, and they don't want to have to do the extra compliance things. And
they don't want to do the work.
I would say that's our number one thing that we run into as we're trying to earn the trust of a new employer is what's the risk in this? And I would say, the way that we go into this with proper education and the way the contracts are set up, there really is no risk.
Yeah. That's right. And that's exactly where, from a level funded standpoint or a 12-18 on a traditional spec and ag, that's kind of my comfort zone, especially if it's a group 100 or above. It's like, hey, let's just do this as responsibly as we can, because otherwise it will come back to haunt you. And there's things they have to understand that we can't predict the future. We don't know who you're hiring. You don't get health information from, your new hires, or things happen. People have they have genetic predispositions that occur that you just, these things do come up. But if you do it in moderation, do it very conservatively, you should be in a really good spot. And you're going to give yourself control because you're going to get the access to the data, right? The one thing that they haven't had, and to be proactive with that data. Because we have some other levers that we can deal with when we have a catastrophic claim to help them reduce that for future risk. And so it's really eye-opening.
I think that's important with the data piece, because we may be talking, or some listeners may be already self-funded, and they may be working with someone that doesn't dive into the data like some of we dig into the data not just one time a year, but multiple times a year, if not every month, which is important because, like you said, that rearview mirror, again, that if you aren't using the data to take action, then if your advisor is just showing up with a renewal every year, well, what good is that data? And I think there's a lot of agencies out there that talk about their data analytics platforms and this and that, but they're not using it the best of their ability. So you got some of these employers that are already self-funded, but they're just continuing to see these increase after increase and no actions being taken.
It's a lot of fear. You nailed it. And we have a lot of brokers that are complacent out there that they just, work's a 4-letter word and exercise is 2 4-letter words glued together. And so you have got to sit down with your clients and let them know this is not going to be easy. I mean, it could run really, really well, but there's going to be more things you're going to have to deal with and set those expectations. But in the long run, the return on investment is going to be phenomenal for your organization. If you really want to wrap your hands around getting control of this monster that is out of control everywhere, it's a hurricane.
Yeah. Well, yeah, I was just going to say before you said that, it's like, it's not going to be easy, but it's going to be meaningful.
Yeah.
And you need to apply resources to it.
Yeah.
Just like you would any other area of your business, like you do with, risk management and your work comp and safety programs and things like that. You're applying people to that business, just like you apply people to HR, you apply people to your finances. And I would say that there are some employers that are like, well, if we move from this fully insured plan to this other plan, how much harder is it going to be? Well, it's not going to be easy, but it's going to be worth it.
Yeah.
Because we're talking about one of the largest expenses in your business. Not only is it an expense, but it also directly impacts your people and their health and their productivity and their finances and everything else. And it's this whole trickle down effect. And the number one reason for bankruptcies is healthcare related expenses.
And here we are back to dough, right? So and when you say, well, it's not going to be easy, that's immediately going to have them go to, well, that means it's going to be difficult. No, difficult is when you don't set the contract up right. And so we want to make sure that when we walk in as responsible agents, we say, we're going to have a pay-as-we-pay contract on your stop loss, because you've heard the gamemanship are like, well, we don't cover that under our stop loss contract. And the TPA's got their interpretation. They both have medical directors. If you have a third-party administrator and a stop-loss carrier worth their weight in salt. So you don't want to avoid all the arguments and say, the SBD, you need to honor the SBD, pay as we pay. And the other thing we're not going to get into as much as possible is lasers, because that's the other pitfall people have at renewal. Like, hey, this went pretty good this year. However, we got somebody that's got kidney failure, and now that individual has been lasered. Yes, pointing the laser at you. Now they have a $250,000 deductible that has to be met, as opposed to everybody else having $50,000. Well, that just defies gravity of what insurance is. So working with the stop loss carriers, at least put a cap on, no laser at renewal. Say, hey, we're going to do business with you, but I want it written in the contract, no laser at renewal. I want pay as we pay, and I want to also have a rate cap on that renewal, because I don't want to start plugging things and unplugging in. So we're not saying it's going to be difficult. It's just a matter of knowing what you're selling and knowing what you're buying and making sure you've got somebody there that has the chops to walk you through these things so that you don't have the pitfalls. Because, the sweet taste of a sweet deal, right? Low cost deal is overtaken by the stench of poor quality real quickly.
Yeah.
And these things can go sideways. So it's just getting all that information up front. I'm overemphasizing it. I don't want to overcompensate, but that saying it's not going to be easy doesn't mean it's going to be difficult. It's just going to be, you're going to have to be part of this.
Well, and things start to get, a little bit more complex when you move to, more of a traditional self-funded plan. And so there are, carrier-based self-funded options for you, where Blue Cross has self-funded options, United Healthcare, so on and so forth. But still, they're trying to keep every piece of the pie with their organization, their stop loss, their pharmacy benefit manager, their network. And employers, I think, sometimes don't realize that they can choose their own partners in those cases.
Yeah.
And so that's when we can really start to ramp up on, customization. And not all TPAs are created equal. Not all stop loss carriers are created equal. Not all PBMs are created equal.
No.
And it's the stop loss piece that I think, we've become more, intelligent on, especially as we choose partners, because what's the stop loss's job? It's to protect, your plan of high cost claims, through a specific deductible aggregate. But they want to know the components of the plan, because if you have the right, just vendor partners, the right TPA, medical management, steerage, direct primary care, pharmacy benefit manager, everything, that's going to allow them to get more competitive on their pricing, which is super important. That I think a lot of people don't realize, that you can't just say, hey, here's the plan. Then they're just going to price it very, conservatively.
Yeah.
And if you have a good stop loss partner that, knows how you conduct your business, and you're looking at data, you're taking action, and you're bringing the right partners to the table to reduce on the frequency and severity of claims, then they're going to get more aggressive on their pricing.
Ball. They will. And, they're not going to take the initiative with you as an agent and say, they'll ask you a background on the case. They're going to make sure they're doing their forensics on it before they give you a number, but they're basically dating you at that point. And they want to make sure that you know that you're going to be in it for the long haul, and you're going to open the door for me and take care of my dinner bill or whatever it is. But they're not going to go out there out of their way and say, hey, Colton, have you considered doing these things or that those types of things? Because they know they've already lost the battle at that point, that they're not there to train you. Yeah. But when you, as the agent and the consultant, go in and say, the things that I talked about, pay as we pay, to make sure that or we have advanced funding, and all the other vernacular I can bore the world with in this podcast, but the levers that we can deploy, they're going to play ball with you, and they're going to give you the decrements in the reinsurance, and then they know they got a long-term partner. They're going to work hard for that renewal, and they know that you're going to be walking through the numbers with them throughout the year, and those are the people that you want to do business with, and believe me, they're out there.
Yeah. Well, I feel like we're going to sound like a broken record, but with some of our carrier-based plans that we have to run into or deal with, sometimes they have size requirements, and so you have to have at least 250 employees or more to carve out your PBM or your stop loss. So they make it very difficult to customize your plan and do carve-outs. Well, why do you think that they would do that? Yeah. It's because they're making money off of every piece of the pie, and they don't want you to do any carve-outs. And so we've spoken to employers that, we understand that we need to find a new PBM, but we're just not big enough. It's like, okay, employer, well, you don't need that TPA that you're working with. Yep. We can go to an independent TPA that will allow you to customize as much as you want. And it just blows my mind that, some of these carriers just force you that, hey, here's our blanket product, and it's going to cater to every employer, no matter what size, no matter what geography, no matter what industry. Every employer is so different in what they're dealing with in their marketplace and their people and what they need and their claims and everything. You need to be able to customize. And so at the end of the day, we can build a plan that's going to better serve and look and feel like what they had with that carrier, but it's going to actually start to tackle, some of their high cost claims areas, or even taking the proactive approach to claims, because you never know, that new hire that may be on this, $25,000 drug, or they're seeking this infusion treatment or things like that. So employers need to take that proactive approach too, and putting these safeguards in place on their plan instead of being reactive. Now they're being more proactive.
Yeah. You're zinging them today. And I'll tell you, it just made me think that, in the commercial insurance business, which, the other part of our divisions deal with, they have great carriers for public bodies and great carriers for construction, right?
Yeah, that's a good point.
We have to make, you kind of made it.
Most states have literally one carrier that dominates that state.
Yeah, right. And so, again, it's our duty that we need to work with the stop loss carriers that are really good in certain kinds of spaces. So like, hey, we're really good at public bodies. We're really good. You see it in the life insurance and disability. It's like, hey, do you have any public body business or do you have any construction business? And so got to take that same mindset to the stop loss market and the TPA market, because we got TPAs that are wonderful with healthcare, but they may not be so good at manufacture, or vice versa, whatever it is. You've got to be able to juggle all the proverbial balls that we deal with in this business and find the right players for the right space that we're dealing with, and be that expert in that, because you're right. Every employer is different. Even you got two construction companies, they have two entirely different benefit plans, right? Some have a 401k, or they'll have a life insurance, whether it's voluntary or employer paid, et cetera, et cetera. And it's the same thing with deductibles and everything. So, but there also is a mindset. You know, I've dealt with a lot of associations, dealt with the Iowa Society of CPAs, the Iowa Medical Society, the Iowa Dental Association over the years. And so they have a way of doing things. I'm just telling you. And you see it with public bodies, you see it with hospitals and everything else. And so you got to be able to deploy the right product and the right vendor for that. And that's kind of threading some needles in there, but and some people are hot for it one year and not so hot the next year. But it's critical.
Well, I
part
think
of our
that's
job.
it's part of us asking the right questions to the employers. What do you want for your people? And
I want to see my doctor, Colton.
Yeah, access.
Yeah.
Part of it's asking the employer, what do you think your people need? Because they know them much better than we do. But then part of it is what does the claims data say, and what their people needs.
Yeah.
And then, part of it is, choosing the right stop loss partner based off the strategy, but then the right TPA based off of geography, because some TPAs have direct contracts. Some might have some, steerage already built in, and so on and so forth. So it's on us to ask the right questions and then use our expertise to try and pair them with the right dance partner.
Yeah, well, we call ourselves benefit engineers, right? Well, I think we're also now benefit re-engineers. Is that a term?
Sure.
Well, it's going to be today. But we're kind of, we're reverse engineering the healthcare industry. Like, we're crawling up backwards through all the fun that we've had to deal with in our lives and just trying to figure out where all this money's going, and then comparing it on the front side of the cost versus the back side of how we got there. So big stuff.
Well, I think, I looked up a couple stats before we got on here, just to kind of articulate that we're not just making this up. And level funded plans have grown 30% among employers between 50 and 200, or 50 and 500.
Yeah.
We're even seeing employers as little as 5 level fund. So it's not as scary as people think it is. And self-funding as a whole is up to 65%.
Yeah.
So if you're an employer listening to this and you're on a fully insured plan, I think it's time to really get educated properly by the right individual, that's us or somebody else that understands level funding, self-funding, how to build these type of health plans that aren't just a one-year solution. These are multi-year solutions. Kind of going back to what we just talked about at the beginning, like, employers are starting to wake up and move to these arrangements because they can't continue to take on these huge increases, and they're demanding transparency and control because they have that in every other area of their business, and they haven't had that in healthcare or health insurance, and however you want to articulate that. But
get a plan grader. That was a really innovative step in my my reborn world of faith here in healthcare. Is there are strategies out there where you can actually have your plan graded by a third impartial party to say, how do we stack up? What can we do better at? And so, you'll get a grade back. You may not like the grade.
Well,
and then they'll give you suggestions.
That's a good point, because there's a lot of people that run around with not only their data analytics platforms, but they say we have the best benchmark reports out there. Yeah. And it's like, well, you're benchmarking against healthcare across the country. Well, healthcare across the country sucks.
Yeah.
So even though you may be below the benchmark, you can your broker may make you feel good about that, but there could be more that you could be doing.
Yeah. Well, we can give ourselves ice cream headaches pretty quickly, but we want to make sure, we're on task here, and there is a better way. We've seen it. We're not so smart. We made it up, like you said. And I think just foundationally, I think in Iowa, just over the last 2 years, I've seen an immense amount of change. And a lot of people, again, are frustrated with their costs, and they're asking the questions. I mean, you look at a factory, if a part hits the floor, they lose money. And they're tightening their belt on a lot of things. And I think 2026 is going to be a epic year of change. I really do.
Yep. Well, and I think we can, say that, self-funding isn't for everybody.
Yeah.
There are, groups that are starting to look to ICRAs, for example. I don't want to go down that rabbit hole, but I wouldn't say ICRA is a long-term solution either, because what's happening in the individual space.
Yeah.
Those plans are going up double digits. But it may be a Band-Aid for the employer for a couple years if they're dealing with claims intensity. But getting to that self-funded world where they can see the transparency and have that control over their plan. We spend 99% of our time educating employers on self-funding and how to do it the better way. Because you can't just go self-funded. And I hear a lot of people on LinkedIn and other podcasts that self-funding isn't the destination. It's the beginning of the journey.
Yeah.
You don't just go self-funded and then say, okay, we made it.
Yeah.
Everything's going to be sunshine and rainbows.
Yeah.
No, you're continuing to dive into the data, tweak, find different vendors, find different partners, because the whole goal is to A, try and find vendors to lower the unit cost of care, or B, how can we completely remove those claims to the plan and try and get your people healthy and all those things.
Well, yeah, right. Because at the end of the day, the underwriters have to show up to the calculator. And it might come down to just an analysis and say, you are in the best spot you need to be right now, or that where you're at.
Yeah.
And we've actually seen some groups that have gone back to full insured after being self-funded. So we're not saying that's just the only way to go here. We're just saying, generally speaking, over time, you can't beat self-funding. It gives you the most control, the data, the proactivity, the ownership of the employees. It's a big package of information to throw on the table of a company that's fully insured. But
so I think the takeaway really for employers is making sure that you are working with an advisor that understands stop loss.
Yeah.
But then secondarily, they need to be able to customize a vendor stack that's really going to meet your needs, but also, just from a cost containment standpoint. We had Dr. John on here talking about direct primary care. That's a great resource. We had Amy talk about pharmacy benefit management and paying for medications for less, increasing adherence. There's so many different tools in our toolbox that we can deploy that can really put a lot of safeguards on your self-funded health plan, especially even if you're dealing with lasers and things of that nature.
Yeah. Well, and I think, teaser alert, we're kind of building these pillars out here. And so in an upcoming podcast, we're going to get people on the front line of healthcare about what they're doing from the specialty side and how they're taking control of this as well, because they're fed up like a lot of folks are, and they want to stay in business and take care of their patients. So again, that's as far as the teaser alert will go, but we've hit some really good pillars. Foundationally, it's DPC, right?
Yeah, and even to bring this full circle and how this is, connected to community connected health. I mean, our whole goal when we're meeting with employers is how can we build you a health plan that is not only going to meet your needs, but cost less. Yeah. Because our whole goal is to try and keep as many dollars within that organization's four walls and in your employees' paychecks and in their, bank accounts, and trying to get them to lowest cost, care avenues, whether that's lowest cost MRI, lowest cost medication, lowest cost this, that. Because again, we're just trying to keep as much dollars in the communities that we're working in as possible.
Everybody wins. I mean, I don't know what you could say negatively about our goal is to keep the dollars within your four walls, and it's a long-term solution. And, Yeah, I mean, we've had so many stories of people getting laid off, or they couldn't build a research and development facility, or what have you. And I mean, it trails into everything. I mean, healthcare has got a residue on every single thing, whether you're buying a car or going to college. Why is student debt so high?
Yeah.
You could argue, payroll and benefits are driving. It's a pass through. It's a tax to the students who are the customers, right?
Yeah. Well, I mean, I even saw something online that they took a picture of a receipt at a restaurant, and one of the line items was benefits, and I think it was just wages and benefits or something like that. So, I mean, employers are feeling the hurt, and if you really want to get pissed off, health insurance is one of the biggest wealth transfers. In my opinion. You're paying these insurance carriers a lot of money. Like you said, it's more than your mortgage in some cases. All this money, and you're hoping and praying that they're working in your best interest. Yeah. Well, look at what your health insurance costs have done over the last 5 to 10 years, and look at the stock market and these big insurance carriers and how they've performed. I think they're doing just fine. House always wins.
House always wins. And I've had some laureates out there claim that this is one of the biggest national security issues that we have. And I think that the movement is happening in this country. I really, truly do. It's like the civil rights movement or voter rights. You can go back in history. You can Vietnam, whatever. I really, really feel that this is going to be a national social movement that people are jumping on. And I tell you, the best part is the doctors more than get it. The healthcare providers more than get it. We have a duty to salvage the greatest healthcare industry that we have, and healthcare for our patients.
So I think there's enough people
it's a duty.
Not enough people now speaking out.
Yeah.
Whether it's people that work in healthcare saying, "Hey, this is enough," but there's enough patients or everyday Americans that have been burned by the system, and they're saying enough is enough. We just talked to someone at lunch that said, I buy the highest deductible option, I'm healthy, I need something catastrophic, and I'm still paying almost $20,000 a year. So I think the tides are turning. We've got people like Mark Cuban that are now very vocal on LinkedIn, Twitter. He's now started to jump into healthcare, not because he wants to make a bunch of money, that he's really trying to make change and disrupt this industry. And that's, we need more Mark Cubans out there speaking of these things, because you and we sometimes walk into a room to an employer that doesn't know us, no trust, and they just see us as a salesperson, and we got to break down those barriers and try and educate as much as possible and say, hey, we're not here to just sell you an insurance product. We're here to fix this for you. Keep as many dollars in your four walls. And try and take care of your employees and their families along the way.
Yeah, and the most emotionally charged product that has ever been designed by mankind. We're not selling coffee cups or tangible items like you buy in a store. So it's a heaviness that I think the best part of what's happened over the last couple of years is actually having pharmacists and physicians at our table, and vice versa. They're inviting us to their table.
It's making a lot more fun.
It is making a lot more fun.
Because you got the right people sitting at the table, and it's like nothing is more rewarding than sitting down with an employer, and you got a doctor and a pharmacist sitting right there with you, and now you've got the whole system. And it's like, okay, how do we now cut out all the profiteering middlemen that are a disservice to your plan, and let's align ourselves with fiduciary vendors that are actually working on behalf of you, your business, and your people. Yeah.
Amen to all that. And I think it's also a reminder for the wonderful folks who decided to tune into these deals that this is not like the torn jeans of the 1990s or hair bands or the latest and greatest thing. This is beyond stickiness. It feels right because it is right. Yeah. And it's going to be all right. Yeah. And just, we're not telling you to work with
Another
us.
Zinger.
So anyway.
Well, I think even, one of the other things that was top of mind too was, not all self-funded health plans are created equal. And I think we talked about that a little bit. And I was thinking about one of my clients that they were part of a much larger group that was self-funded. They had over 5,000 employees, self-funded, Cadillac plan. It was a school district. They've got some of the best benefits. And then they had to, the contract was getting changed, so they had to go out on their own independently.
Oh.
Well, now they're smaller, they're nimble, they're probably worried about benefits, but they have truly bought into all these strategies. They're doing DPC, they're doing direct contracts, they're doing RBP. They're paying almost half of what that school district is paying now.
Yeah.
So size isn't always, the catalyst that you need to have a bunch of employees or a large organization. It's the right strategy, 100%.
Yeah, we've got to work harder at getting consumers, employers out of the big bad wolf mentality, right? I'll huff and puff and blow your house down. And I can't speak for their experiences, whether they've been self-funded or they've gone to another carrier. This is just a radically different proposition. And we're really going to put the notice out there to the employees. Who's the insurance company? You are.
Yeah.
So partner up.
Create that culture.
Yeah. All right. Well, I think we're kind of in a wrap mode here, are we?
Yes, we are.
Great to see everybody. Community Connected Health. Glad you could join